Hi, very good evening. So this could be probably our last or final academic session before NEET MDS 2020. So tomorrow we'll have a general session, but as I said, this will be our final academic discussion live session in YouTube for all NEET MDS 2020 aspirants. So let's proceed with our discussion. So I have a collection of few subjects, clinicals as well as anatomy. So we'll just discuss few points. We'll spend some 1 hour or so, and depending upon the amount of discussion we have, and then we'll conclude the session, right? So I hope you guys are doing fine. Okay, I hope it's streaming fine. And how about the audio? Shall we proceed? Okay, fantastic. So we'll start with periodontics first. So I have a few questions for you, and before we proceed, yesterday's live session there were two errors. I mentioned about color fatigue. Eye fatigue. Which color do you observe, or should you observe during shade matching and all? It's neutral gray, as most of you rightly mentioned. I posted the correction in the description part of yesterday's video itself. That is dental materials. And second, I think we discussed about a noble metal which is added to addition silicon to absorb hydrogen gas, as you all rightly mentioned, and also as mentioned in one of our key points, it is palladium, not platinum, right? Even I updated the same in the description part of the video. So just go through the description part of yesterday's dental material solution class. You will get additional information. And also, for your information, all 101 key points have been updated in our Telegram updates group. So you can access all 101 key points from all the subjects, right? So if you don't have access, you can just drop a mail. We'll provide you the free updates group link in Telegram. You can download the app and access the group and go through all those 101 key points, right? Yeah. Yeah. Okay, so first, we'll start with periodontics. So I'll randomly ask you some questions, so do let me know. When do you call a child, or we have different phases in one's life. So what is neonatal period? What do you mean by a neonate? First 4 weeks postpartum, one first week to fourth week postpartum, that is a neonate. And what about adolescents or adolescent? Yeah, around 30 days or 28 days, okay? Yeah, first 4 weeks. What about adolescents? 12 to 19 years? Yeah. What about infant? So as you know, we have neonate 1 to 4 weeks, infant up to 1 year, toddler 1 to 3 years, child 3 to 12 years, adolescents 12 to 19 years, okay? Yeah. So make sure that you're familiar with this terminology. So you might have heard of the term natal teeth. So where do you find them? Which region of oral cavity do you commonly find, if at all they're present? In which part of oral cavity are natal teeth present? Yeah, natal teeth are those which are found at birth, usually in mandibular incisor or mandibular anterior area. Good. And what about neonatal teeth? Teeth which erupt in the first 30 days? Where are they present, if at all they're found? Which region of oral cavity do you find neonatal teeth? Yeah, it's again mandibular incisor area. And one general question which is related to deciduous teeth: why do you call deciduous teeth as milk teeth? Why do you call deciduous teeth as milk teeth? If you observe along with us, we have a fly which has joined us for the live session. It's right on the lens. In fact, I can see it just above the lens. So you can say hi. In the meantime, it will be coming and flying across the lens. It's been literally years since I had seen a fly. Mosquitoes are quite common, right? Yeah, milk teeth. It's not because babies drink milk, but because of refractive index, which is similar to that of milk. Milk teeth. Good. What's the refractive index of milk? It's definitely not 1. What's the refractive index of water? Yeah, I can see the fly. What's the refractive index of water? Yeah, water it is 1. Water is considered as a base. Yeah. Can you give me some synonyms of nursing bottle carers? Some synonyms of nursing bottle carers. Atul says Manikyam. Who is Manikyam? Okay, early childhood care is baby bottle tooth decay, bottle mouth syndrome, nursing care is bottle care is infant care is, etc. So, which of the following is not a synonym of early childhood care is? Fine. So, all of them. In case of rampant caries or nursing bottle caries, which microorganism is commonly implicated or whose activity is found to be at the peak level? Name the microorganism which is commonly implicated in case of nursing bottle caries. And also the order in which the teeth are affected is very, very important. So in case of nursing bottle caries, which teeth are frequently affected first and which teeth are spared or protected because of the action of tongue or because of the presence of tongue? Yeah, Streptococcus mutans is something which is commonly implicated. The teeth are decayed in which order? I'm sure you're familiar with these concepts, right? Yeah, mandibular incisor would be the least because of protective action from the tongue. Yeah, maxillary anteriors will be the first, mandibular anteriors will be the last. Good. When was first artificial water fluoridation done? In one of the key points, in today's key points, I mentioned about salt fluoridation. Salt fluoridation was first introduced in Switzerland. So when was the first artificial water fluoridation introduced and which place? This is just for sake of general knowledge. Grand Rapids, Michigan, way back in 1945. Good. Excellent. So we discussed about fluoride levels in one of the live sessions yesterday, right? So you know about the fluoride levels in public water supply, etc. Fine. Optimal fluoride levels we discussed like 0.7 to 1.2 ppm. Okay. And also various theories, of psychosocial development, years. What do you mean by anticipatory guidance? What do you mean by anticipatory guidance? Yeah, so you might have heard of this term several times either in your Viva or for 2 marks usually asked in PILO. What do you mean by anticipatory guidance? you haven't heard of, that's fine. So anticipatory guidance is a proactive counseling of parents and patients about developmental changes that will occur in the interval between health supervision visits that include information about daily care taking specific to the upcoming interval. So you're anticipating some changes within the oral cavity. So as a practitioner, as a doctor, you know what you can expect or anticipate in a particular patient, and then based on which you will counsel the patients. You take for example ugly duckling stays. So usually that's the situation where the child is very much troubled psychologically. So when do you see this ugly duckling stays? So it's like you counsel the parents, you counsel the patients regarding this prior itself, and then providing them adequate support. That's one just small example which I can give you. So what do you mean by ugly duckling stays? In which age group do you usually find this, and which teeth are responsible for this ugly duckling stage? Yeah, usually 9 to 11 years during eruption of canines, there will be lateral flaring with midline diastema. You might have seen, many children with this ugly duckling stage. Excellent. Most commonly, injuries to deciduous teeth occur during which age group? Most common injuries to deciduous teeth occur during which age group? 1 to 1.5 to 2, 1 to 1.5 to 2 to 2.5. So toddler stage. Primary teeth are frequently displaced or luxated than fractured, if at all there is any trauma. Listen to this statement. Primary teeth are frequently displaced or luxated than fractured. Why? What could be the reason? Pliable alveolar bone, elastic bone. Very good. Pliable alveolar bone. So as you know, ugly duckling stairs, the permanent central incisors are flared laterally because the unerected laterals canines constrain the roots of centrals. We discussed about ugly duckling stairs. And serial extraction is one topic which we discussed in our e-classes as well as study club. So just tell me the sequence. In Tweed's method, what's the sequence? In Davis' method, what's the sequence? Nance method, Moyer's method. So we'll just confine to one method, Tweed's method. Just tell me the sequence of extraction in Tweed's method. Good Papia. Tweed, it's a D4C. Yeah, Tweed's method, it's D4C. Davis' method, CD4. Nance method, D4C. Moyer's method, BCD4. So indications, contraindications, again, make sure that you're familiar with them. What do you mean by green stick fracture? What do you mean by green stick fracture? Incomplete fracture. Okay. Name the components of periodontium. You know what periodontium is. Name the components of periodontium. You might expect a question like all of the following are components of periodontium except. The question is appearing very easy, right? So let me tell you why I've asked you this question. Cementum bone periodontal ligament. Gingiva. Okay, so periodontium includes gingival, periodontal ligament, cementum, and alveolar bone. Next question, just a random question. How many mandibular incisor teeth are present in oral cavity? Or in human dentition, how many mandibular incisor teeth are present? I put this question in one of the key points as well. See, still I'm getting mixed response. 4, 16. I don't know how it is 16. Yeah, so go through the question and all the options carefully. It's 8. Deciduous as well as permanent. What is the thickness of junctional epithelium? Hi, Chavi. Hardik, we're talking about mandibular incisors. I've asked you how many mandibular incisor teeth are present. Okay, very good. What's the thickness of biologic width? Around 2 mm, 1.97, around 2 mm. Okay, 2.04. Yeah, 2.04. Very good. What is the first detectable sign of gingival inflammation? What is the first detectable sign of gingival inflammation? Even before bleeding on probing, increase in GCF. Increase in GCF is the first detectable sign of inflammation. I mean, if any one of you has a concern, you can refer Karanza and get back for clarification. Increase in GCF is the first detectable sign of inflammation. So now, let me ask you one controversial question. Is GCF an exudate or transudate? GCF is, gingival clavicular fluid is exudate or transudate? Very good. It's both depending upon the situation, so depending upon the conditions. So normally it is transudate, but during inflammation it becomes or it is an exudate. Even in Karanza it's mentioned the same, depending upon the situations or conditions prevailing, it is either transudate or exudate. What's the amount of attachment loss in case of gingivitis? And what's the amount of bone loss in case of gingivitis? In gingivitis, what's the amount of attachment loss and bone loss? Arushi, if one option is to be chosen, then you decide which option has to be chosen. No, I'm not kidding. When you know the fact that it's both transudate and exudate, does it really matter which option you have to choose? If you have both, luckily then you can choose both. If not both, then you can go with any of the options. Provided, go through the question carefully, whether it is a normal GCF or did they mention inflammation or any pathology in the question. So depending on that, proceed accordingly, right? There is no bone loss, no attachment loss in case of gingivitis. Don't fall in soup. especially when you're answering such questions, right? Good. Name the microorganisms which are implicated in aggressive periodontitis. I know. Okay, why don't you just type out the entire spelling? So anyways, Actinobacillus actinomycetum comitans, Prevotella intermedia. We only have two A's, right? Okay, Tanya, very good. Prevotella, Eichhornella, Actinobacillus actinomycetum comitans, Capnocytophaga, etc. Linear gingival erythema is one of the important distinguishing features in which condition? Good, Arishi. Good, Divya. Yeah. AIDS. In case of AIDS, in case of HIV gingivitis, it's characterized by linear marginal erythema. I hope you have seen the clinical image as well, right? So which of the following radiographic technique or which of the following radiographs are accurate in determining the amount of bone loss? Periapical radiograph, occlusal radiograph, bite wing, all of the above. So which among the following is more accurate in determining the bone loss? With IOP or periapical, you have this angulation issue. Bite wing will give you more accurate assessment. There will be no elongation or shortening, foreshortening. So bite wing is the appropriate answer. Accurate assessment of periodontal, especially interdental bone loss, right? Bite wing in the sense you can consider that as parallel angulation. Yeah, I mean, if you can compare bite wing with an IOP, you will know it by yourself. Which of the following type of calculus is okay? I actually wanted to ask you the color of the subgingival calculus and supragingival calculus. Is there any color difference between subgingival and supragingival calculus? Or which of the following is darker, subgingival or supragingival calculus? Subgingival is usually darker, supragingival is white or pale in appearance, as you're all familiar with. So what are the sites where you find common finding of supragingival calculus in oral cavity? Which areas in oral cavity you commonly find supragingival calculus? So openings where you have the salivary ductal openings, lingual surfaces of mandibular anteriors and buccal aspects of maxillary posteriors. Good. What do you mean by pericervicular dentin? PCD. What do you mean by pericervicular dentin? Yes, Vaishna. What that 4 mm criterion? Yeah, you can refer one of the videos where I try to cover the same pericervical dentin. As I said, 4 mm of dentin above and below the alveolar crest. Okay, so this dentin is considered to be very crucial because especially during endodontic treatment, to maintain prosthodontic, endodontic and periodontic continuum, this dentin is considered to be very essential as it preserves the integrity as well as the longevity of a particular restoration, including the tooth structure as such. Pericervical dentin or PCD. Yeah. So, can anyone give me the definition of health by WHO? What's the definition of health given by WHO? Does it include only, my point is, does it include only the physical aspect or are there any other aspects of health which we are dealing with? Yeah, pericervical dentin, it's 4 mm above and below the alveolar crest. So it's not just physical, it's also mental as well as social well-being, right? So when you say you're healthy, you should keep these 3 parameters in mind, which means most of us are not healthy. Even if we are physically fit, just because of our age factor, what about emotional health? What about social health? What about relations? And also the indices are very important. If at all they ask you like which of the following index is a reversible index or which of the following is an irreversible index, you should be able to make out. Simplified oral hygiene index, is it a reversible or irreversible index? Simplified oral hygiene index, OHI. Very good. So health is defined as a state of complete physical, mental, social well-being, and not merely an absence of disease or infirmity, according to WHO. Oral hygiene index, it is a reversible index. What about PMA index, papillary marginal attached gingival index? Is it a reversible or irreversible index? Good, it's a reversible index. What about DMFT index? DMFT, DMFS, is it a reversible or irreversible index? It's an irreversible index, very good. And I'm sure you're familiar with all these terminologies, right? Crude death rate, case fatality rate, proportional mortality rate. A single examination of a population which is done at one point of time. You're just examining it at random. You're gone to a place, you're trying to examine a particular disease at a particular point of time. So what does it come under? A cross-sectional study or a longitudinal study? Good, cross-sectional study, also called as prevalence study. So when you're doing some observations over a period of time repeatedly in the same population or a prolonged period of time by means of follow-up exams, they are longitudinal studies. So if you want to analyze or find out the etiology of a particular disease in a population, which study do you think would make more sense? Cross-sectional study or longitudinal study? You want to find out the reason for that disease, etiology. So which study would you consider taking up? A cross-sectional study or a longitudinal study? So cross-sectional only gives you the burden of disease at a particular point of time, but if you want to know the etiology, it's only through follow-up. Longitudinal study, as you rightly mentioned, is right answer. And also the levels of prevention, primary, secondary, tertiary, we discussed in detail in one of the live sessions previously last year. You can refer that video for more information. And we'll conclude with, we'll conclude public health dentistry with this. So there is a criteria for establishing health centers at various areas, plain areas or tribal areas. So sub-center, so we have various health centers, namely sub-center, primary health center and community health center. You might have heard of these names n number of times because we wish to seek jobs in those centers, right? It's a livelihood for thousands and thousands of dentists, if at all jobs do really come up in those centers. So sub-center, what is the criteria based on population? So for how much amount of, or how do you quantify in terms of population, like for how much population should we establish a sub-center? We in the sense the government. And for how much population in plain areas, how much population in tribal areas should government establish sub-centers, primary health centers and community health centers, so that they can cater the needs of that particular target population. So we should get familiarized with these numbers or statistics as well, not statistics as such, but the actual numbers, based on statistics or based on case reports. Very good. So 5,000 in plain, 3,000 in hilly areas for sub-center. Excellent. What about primary health center or PHC? Good. What about primary health centers? $30,000 and $20,000 respectively. Excellent. What about community health centers? 1,20,000 and 80,000 respectively. That is in plain areas and tribal or hilly areas respectively. Good. So it seems like you're all very well prepared. So the next subject which is coming up should be a cakewalk for you. Name the 4 unpaid bones of cranium. The 4 unpaid bones of cranium. We're talking about cranium, not the facial skeleton. Yeah, occipital, frontal, sphenoid and ethmoid. Very good. So can you name the parts of temporal bone, like how many parts or how many extensions does a temporal bone have? You know, we have a squamous part. So likewise, what are the parts of temporal bone? Squamous part, petrous part. Good. Zygomatic. Yeah, squamous, petrous, zygomatic. Okay. Name the lining of maxillary sinus. I'm sure you're aware of it and you're very much familiar with this topic of maxillary sinus. Name the, the histological aspect. Name the membrane which is surrounding or lining maxillary sinus. Schneiderian membrane. So what is it histologically? Is it a ciliated epithelium, columnar epithelium, or a squamous epithelium? Pseudostratified ciliated columnar epithelium. Good. Blood-brain barrier is absent in which areas in brain? BBB, blood-brain barrier is absent in which areas in brain? Okay, good. Pituitary. You can just make a note. Hypothalamus, pineal gland, area posterior of fourth ventricle, and areas near third ventricle. Hypothalamus, pineal gland, area posterior of fourth ventricle, and areas near third ventricle. How many branches does an internal carotid artery have in neck? In the region of neck, number of branches from internal carotid artery. 2, 4, 6, 8. You didn't fall for it, right? Okay, Ramya says 4. Ramya, I have seen your message. You just retracted it. Okay, that's fine. That's absolutely fine. Aditi also says 4. So Ramya, you have a partner. Okay, internal carotid artery doesn't have any branches in neck. Name the cranial nerve which innervates the muscles of tongue. No branches in neck, right? Name a cranial nerve. Name the cranial nerve which innervates the muscles of tongue. Hypoglossal, except palatoglossus, as we know. So palatoglossus is innervated by yes, Ramya. Okay. I was asking the branches in neck. Glossopharyngeal, spinal accessory, vagus. Very good. I'm getting all the nerves. Cranial accessory. Okay. Name the muscles which form a sling around the mandible. The muscles which form a sling at the angle of mandible. Name them. The muscles which form a sling around the angle of mandible. Yes, Khyati. Good. Yeah, medial pterygoid and masseter. What do you mean by torticollis? Torticollis. Torticollis. Yeah, medial pterygoid and masseter form a sling around the angle of mandible. What do you mean by torticollis? Also called as wry neck, because of injury to which muscle? Stiff neck, wry neck, injury to SCM, sternocleidomastoid muscle. Good. Name the muscle which makes it difficult to place IOPA films in oral cavity. Name the muscle, especially when you're taking lower teeth. which makes it difficult to place periapical films in the oral cavity. Very good. Mylohyoid. All cranial nerves originate from the brainstem except, name the exceptions. By the way, how many cranial nerves do we have? And also all cranial nerves originate from brainstem except. So is it 12 or is it 12 pairs? Okay, it's 12 pairs. Good. Taste sensation from anterior 2/3 of tongue is carried by which cranial nerve? Taste sensation from anterior 2/3 of tongue. Chorda tympani, facial nerve. What about general sensation from anterior 2/3 of tongue? Good. General sensation from anterior 2/3 of tongue. Lingual nerve. What about general sensation from posterior 1/3 of tongue? General or special sensation from posterior 1/3 of tongue. Glossopharyngeal or ninth cranial nerve. Good. Which of the following branches of trigeminal nerve are sensory in nature? They are purely sensory in nature. Which of the branches of trigeminal nerve are purely sensory in nature? Which of the following branches of trigeminal nerve are purely sensory in nature? Ophthalmic, maxillary, and mandibular. You have both sensory and motor branches. It's mixed, right? Yeah, buccal being sensory. Good. Gag reflex. You know about gag reflex, right? So gag reflex is mediated by which cranial nerves? Glossopharyngeal, afferent sensations by glossopharyngeal, efferent sensations by vagus. Glossopharyngeal and vagus. In fact, we even have glossopharyngeal nerve block, which is incorporated in clinical practice to control gagging in patients with severe gag reflex. Which is the smallest bone in the entire human body? smallest bone in the entire human body? Is it malleus, incus, or stapes? Stapes. Stapes. Okay, so stapes is smallest bone in the entire human body. And I'm sure you're familiar with the calculations part of LA, right? If you have any doubts, you can just check out my video, Local Anesthesia Calculations. You'll get a comprehensive overview of the entire calculation part. If at all they ask you any question from the same, you'll be able to answer it, right? So this is one of the most commonly asked questions. Following anesthetic injection, sensation which is lost first includes pain sensation, cold sensation, warm touch, deep pressure, motor. Which of the following sensations is lost first following an anesthetic injection? Good. It's pain which is lost first. Which of the following anesthetic agent or drug is named as milk of amnesia? This is just for general knowledge, okay? Milk of amnesia. Yeah, pain, touch, pressure. Pain, cold, warm touch, deep pressure and motor. Good. Milk of amnesia. Good, Tanya. And propofol. It's propofol. See, if you have no idea, it's better you don't mark it if at all a question is asked in an entrance, right? What do you mean by BAMA rule? B-A-M-A. This is not to frighten you, but since it is fun, I am discussing it. The term BAMA is fun. What do you mean by BAMA rule? You know BAMA? B-A-M-A. Chicken sandwich has no idea. Okay, chicken sandwich. No, it's not. It's not Obama. It's Bama. Okay, it is buckle always moves away. Another name for slope rule. Same side lingual, opposite side buckle, or buckle always moves away. Bama rule. Okay. It's good to see some smileys. So during emergency procedures, when you're performing, cardiopulmonary resuscitation, what is the first thing you do? Do you check airway, breathing and circulation followed by definitive treatment, or is there any alteration in that sequence according to AHA latest guidelines? Yeah, CAB is the right answer. Previously it was A, B, C, D, but now it's circulation first. It's no more airway first. Just keep this in mind. Okay, you just check out latest AHA specifications for CPR, basic life support. Yeah, circulation followed by airway breathing and so on. which is the most common facial fracture? Which is the most common facial fracture? Yeah, ACLS guidelines. Yeah. Chavi, as per me, it's circulation. No, it's not as per me, it's as per AHA guidelines. Yes, Chavisha, of course you have to. Even when we were preparing for entrance, even I attended BLS, so we were taught like ABC. But check out the latest guidelines, it's no longer ABC. Way back in 2009 itself, they brought about these newer guidelines. So you can just check now and confirm and let me know. Yeah, nasal bone fracture is the most common facial fracture. Kamakshi, orbit, the most affected part we had discussed n number of times. The weakest part, the most common part or the most common wall which is fractured, you can just get back through mail. I have a draft which is always readily available so that I can share the same with you. So what do you mean by cleft lip rule of 10? Yeah, cleft lip rule of 10. Okay, Chavi. Yes, 10 weeks of age, weight at least 10 lbs and at least 10 grams per deciliter of hemoglobin. So which antibiotic is preferred to treat dry socket? Which antibiotic would you prescribe for treating dry socket? And guys, I forgot to mention we have latest antibiotic guidelines which are posted in e-classes. And if anyone needs any assistance related to the same, you can get back through mail. Those guidelines were published by JADA, Journal of American Dental Association, in December issue, and they were also mentioned in AAE, American Academy of Endodontics Journal. So we have some one or two important updates. So latest antibiotic guidelines. This is not to create panic, but I'm trying to provide you information. Way before I've even updated the same a few weeks ago in our updates group as well. So anyways, it's never late. You can just check out JADA, or you can check out AAE website, or you can just Google, which is simple to do. Latest antibiotic guidelines 2019, or you need information, you can let me know through mail. Okay? No antibiotics for dry socket. Good. Thank God. So at least when you start practicing, please don't prescribe antibiotics just like that. Sometimes it's like even when we know the facts, just because everyone is doing it, we do it. There's no logic, but we just do it, just because everyone is doing it. And various space infections, boundaries and all, I'm sure you're familiar with these concepts, so let's not worry. So enucleation, marsupialization, curettage, fine. Okay, few more minutes, we'll try to wrap up the session. It's already 54 minutes. Yeah. Sanjay, I'm there. So why are you bothered about Ravindra sir? I'm there here. Sanjay, I think you're obsessed with Ravindra sir. What's happening, Sanjay. I've been observing for the past 2 or 3 live sessions. I don't know why, but Sanjay is really obsessed with Ravindra sir. So, any image-based question from Ortho Appliances, I'm sure you'll answer it, right? What is a three-quarter clasp? What do you mean by three-quarter clasp? Aditya, I don't think he must be his senior. He must be his junior. It's like some ragging is going on in the form of comments. Three-quarter clasp, also called as circumferential clasp or C-clasp. Which teeth is commonly banded for orthodontic purpose? In oral cavity, which teeth is commonly banded for orthodontic purpose? Of course, it's molar. Good. Can you give me an example for tissue-borne active appliance? I think we discussed this in e-classes. I posted some video also in the form of assignment. Give an example for tissue-borne active appliance. We're talking about functional appliances. No, I discussed this in one of the AIMS discussion videos. Now I remember. Yeah, Frankel appliance. Good. Blocks in twin block are angulated at what degrees? Blocks in twin block are angulated at what degrees? Yeah, third order bend is torque, as you rightly mentioned. So first order, second order and third order. So we even have illustrations. Yeah, first order, as you rightly said, buccolingual, and then second order is mesiodistal, third order is torque, right? Yeah. Okay, fantastic. I think there was a question on the same last year as well. So finally, we'll go through some topics in prosthodontics. What is golden proportion? Can you give me the value of golden proportion? .618. It's a ratio, right? Golden proportion is a ratio. Yeah, 1.618:1. Good. If a complete denture patient complains of burning sensation in mandibular bridge, it could be because of which reason? If a complete denture patient is complaining of burning sensation in mandibular ridge, it could be because of which reason? Pressure on mental foramen. Burning sensation in palatal area. So, see, usually questions with clinical significance, they have a higher chance of appearing in any standard entrance. So, burning sensation in palatal area. Yeah, pressure on incisive foramen. Yeah, could be incisive foramen. Clicking of denture teeth. So, why do you have this clicking of denture teeth? And also based on, yeah, it could be because of excess video, vertical dimension of occlusion, or even in case of porcelain teeth, you will have that clicking sound. And based on mental status of the patient, in the diagnostic part, you might have come across some classification given by House. So a patient or a kind of patient who accepts any kind of treatment, has no expectation, would fall under which category? Accepts any kind of treatment you give, has no expectations. So what kind of category do you put that patient into? So the very same happens after the exam. So after that exam, we all become philosophical and we just say we did what we had to do, and now everything lies in the hands of God. Isn't it? You become hysterical or exacting or demanding. You cannot demand anyone anything, right? Unfortunately, we can't even demand the question paper from the exam center or key or explanations from the exam or from the MBE. That's the situation. What is a Minnesota ditch? Minnesota ditch. Minnesota. Minnesota ditch. What do you mean by Minnesota ditch? Usually placed in a proximal box during your operative dentistry procedures. So it's a V-shaped groove at junction of axial wall and gingival floor of a box restoration placed with GMT to enhance resistance to displacement by occlusal forces. A V-shaped groove which is placed between the axial wall and the gingival seat in a proximal restoration. So along the axio-gingival line angle in simple terms. A Minnesota ditch. What should be the ideal total occlusal convergence when you're planning a cast restoration or extracorneal restoration? What should be the ideal occlusal convergence? I'm sure you know the fact that there has to be convergence occlusally. So what should be the ideal occlusal convergence? Total ideal occlusal convergence. 2 to 5 degrees, 3 to 6 degrees. Okay, go ahead. You have two crowns. One is taller and one is shorter. Which one do you think has a greater resistance towards displacement? You have prepared a tooth, you have prepared two teeth, one is taller and one is shorter. Which one of them has greater resistance to dislodgement forces? Taller one has greater resistance, shorter one just comes out, the crown simply comes out. That's the reason why there has to be a minimum height of 3 to 4 mm of the prepared tooth. Once you're done with your preparation, there has to be sufficient height of the crown. Which finish line is best for metal margins? Yeah, obviously for shorter crown, we go for additional retentive features. Yeah. Chamfer, you prefer, it's a metal margin, best for metal margin. And what about porcelain margins? Shoulder. So, in which cases do you indicate a feather edge finish margin? In which cases do you indicate feather edge finish margin? In stainless steel crowns, we go for knife edge, right? Feather edge is not at all indicated. What is the purpose of a retraction cord in tooth preparation, or in the process of tooth preparation, or in the process of restoring a fixed partial denture or a crown? What's the role or significance of retraction cord? Yeah, knife edge in case of stainless steel crowns, yes. Okay, Daivika. See, clinical practice, no comments. Anyone can do as per their own will and wish. And we should completely respect the opinion of seniors. There is nothing wrong in it. But as per the literature, feather edge is not indicated. In case of stainless steel crowns, we go for knife edge. Yeah, in the process of making impression to retract gingiva to expose the finish line, we use retraction cords, simple braided or twisted, which is impregnated with some chemicals. You know, potassium, aluminum sulfate, epinephrine. Obviously, epinephrine is contraindicated, especially in hypertensives and people with cardiac issues. We have something called as double cord technique, which we practice during our post-graduation also. So we place a smaller cord first, deep inside the sulcus, and then we place a larger cord. And just before taking the impression, we remove the larger cord and we keep the smaller cord in place and record the impression. Double cord technique. Which of the Pontic design is indicated in cases of or in patients where hygiene is a major concern, or in posterior teeth? Ridge lap, sanitary, bullet Pontic, or modified ridge lap? Ukarsha, we remove the larger cord. In double cord technique, we place a smaller cord deep inside or apical in the sulcus, and then we place a larger cord, wait for some time, allow the retraction to happen, and just before injecting the elastomeric impression or taking the impression, we remove the larger cord and we place the smaller cord in place in the sulcus itself. Yeah, sanitary is right answer. Which of the following Pontic designs is most aesthetic? Ridgelap, sanitary, modified Ridgelap, ovate. Which of them is most aesthetic comparatively? Yes, Daivika. Yeah, ovate is aesthetic. So why is ovate considered to be more aesthetic? Is it because of its shape? And also the ceramic methods of fabrication, pressed ceramics, empress, castable ceramics, die-core, CAD/CAM designs, Procero Lava in Ceram. At least try to have that familiarity with these names. If at all it's asked, you should not freak out, right? Yeah. Ovate is considered to be more acidic because it appears as if it is arising from the gingiva or from the soft tissues in the oral cavity. Yeah, it appears as if it is emerging from the socket. Fantastic. So most of the topics, in fact, few of the topics you have given me the answers because I had so many things in mind I couldn't remember certain things without referring. So you mentioned about twin block appliance. You say now it is 70 degrees. And also we discussed about first order, second order and third order. So first order you were talking about labial-lingual inclinations. Second order is mesodistal and third is torque. So I'll refer that once again. And you have any ambiguity or you feel like you need any clarification pertaining to any topic which we discussed, you can just right away drop a mail. I'll review it and if necessary, I'll post an update. I'll reply to you and also post an update in the description part of this video, right? So that we clear out things and ultimately it's all about getting the best and accurate information possible, right? So that's the objective. Subham, yesterday's doubt delayed expansion takes place in 5 days and pain is on 10 days now. Nothing like that, Subham. Usually delayed expansion, it's 3 to 5 days or a week's time. So there can be pain after 3 to 5 days or a week. So what we discussed pertaining to pain on same day and pain after a couple of days, that's right. So if there is pain on same day after amalgam restoration, as you said, as most of you said, it is high occlusion or high point. A pain after a couple of days, it could be delayed expansion. It could be, even though we need to rule out other causes. Yeah, direction of molars, usually molars tend to drift mesially, naturally. Yeah, it's mesial. I thought you were all aware of it. You're familiar with this, right? So there is natural tendency for all the teeth to move mesially. It could be because of proximal attrition, and also there is passive eruption throughout the life, right? So there is movement of teeth occlusally as well as mesially. Third day pain in dry socket, yes, it could be stubborn, but I've given you a case, I've given you a context. I said we have done a restoration in 2 cases. In one case, you have pain on same day, in another case, you have pain after 3 to 5 days. So, in terms of restoration, the context is you've done restorations and there is pain immediately and after a couple of days. Even in dry socket, after 48 hours or 72 hours, there can be pain. That's a different context, right? So I'm not trying to compare them. Okay, tomorrow we'll have a general discussion at 7 p.m. Indian Standard Time because I want to conclude the session by 9 p.m. So tomorrow we'll have a live session at 7 p.m. Indian Standard Time. I'll post an update. We'll have a general discussion. Okay? We'll have general discussion. In fact, I wanted to conclude all live sessions last Saturday itself. but because of my personal issues and I couldn't really complete them ahead of schedule. But I'm glad at least we try to focus more on basics, which most of us have challenges with. So clinicals, I'm pretty confident that all of you are very much thorough because of your theoretical exposure or department's pressure or practical exposure. So clinicals, you'll all rock, there is no doubt in it. So basic subjects, I'm glad we spent additional time for each of them in various live sessions, right? So, yeah, usually in case of primary teeth, because of differences in the organic and inorganic content, the etching time varies. Yeah. In case of fluorose teeth, in case of primary teeth, we say the etching time is more compared to etching time in permanent teeth, right? Yeah. So last minute tips, it's very simple, guys. I wanted to tell you this. It's around 11 p.m. Indian Standard Time. So sleep at least by 11:30. Have a good night's sleep today and tomorrow. Having a good night's sleep is very, very important. And tomorrow we'll have our call session. So I'll be calling each one of you. Just post your numbers in mail. I'll call each and every one of you to wish you all the best personally. So tomorrow will be call session and last minute tips. Just relax, have a good night's sleep today and tomorrow. Eat everything well. Drink. You keep yourself hydrating and do not open any book whatsoever. No book whatsoever. Just relax, watch your favorite movie or your favorite show in any channel or Netflix or whatever based on your convenience. I want you to relax and keep everything aside. Opening something will only create anxiety and you'll feel like you should further refer that and this. Last minute revision is not going to give you additional marks or score, take my word, right? So just keep this in mind, and I've seen literally many students, especially those who are giving +1 and +2 in our state or in several states. I've seen many students who are sitting behind their behind their father in a bike or in a car, and they'll be revising the content even in the last minute when they're having an exam 30 minutes or 40 minutes later. So that kind of revision is not at all necessary because it does more of a harm than good. Take my word. So last minute revision tips, no revision is a tip. No revision, nothing. 24 to 48 hours, just keep everything aside. You've done extremely well. You know what efforts you've put in right from the beginning. That's more than sufficient. That's enough. So take a break. So make sure that you're cool, calm, and composed and confident. That's very important now. If you're panicked, if you're tensed, you're intentionally poking your own eye. Don't let that happen. So no revision last minute. I'll see you tomorrow in live session at 7 p.m. Indian Standard Time. And any one of you who are willing to talk, I'm not going to, bother you with tips and tricks. All I wanted to say is all the best for your exam. Personally, so you can just drop your phone number if you wish to. And all the academy students, I'll be calling you. I have your phone numbers. So tomorrow we'll have our phone session. Okay, and 7 p.m. Indian Standard Time, we will start our live session and conclude it by 9 p.m. Indian Standard Time. So that you will have plenty of time to sleep. Fine? Yeah, you can try breathing exercises. Just focus on your breathing, a simple exercise which helps you to increase your awareness. You'll become more mindful, you'll be more aware of what's happening now, and it helps you improve your memory. You become more attentive. Presence of mind. Arushi, I don't know which books are you're talking about. Don't worry. Just get back through mail. I will also refer some standard literature. It's 15 to 20 seconds, 30 to 40 seconds. The problem with these kind of questions is different articles score different values depending upon the result. So we need to identify the right information which is useful for you in the entrance perspective. So in this case, just refer Phillips once, Sturbins once, and you have any further questions, you can get back to me, right? Yeah. So as I said, this will be our final academic discussion live video for 2020 aspirants. So I wish you all the best, and I'll see you again tomorrow. It's 7 p.m. Standard Time, right? Yeah. Thank you so much for your love. Love you all as well. Yeah. And also join our updates group if none of you are members of it. Or if any one of you is not a member, just join the group, access those one-on-one key points. I'm sure you're aware of all that information. If you're interested, you can just access it. And it hardly takes 1 hour to just skim through all the content. Just 1 hour, that's it. Yeah, bye. Take care. Good night.